I'm a board-certified general surgeon. I'm fellowship trained in bariatrics and weight loss surgery. I'm originally from Ireland, as you can tell by my accent. I actually found it a bit easier to kind of make friends and to develop a circle of friends here than perhaps I did in other parts of the country. So I definitely felt the Midwest warmth after I moved here. My subspecialty interest is bariatrics and weight loss. I'm also interested in anti-reflux surgery, so GERD and things like that, as well as foregut, so diaphragmatic hernias, some more kind of rare issues that not necessarily every general surgeon would deal with. I do quite a bit of kind of more complex revisional work, so patients who've had surgery elsewhere for a certain issue, who've had recurrences of diaphragmatic hernias, problems after their previous or initial bariatric surgery. My training, my degrees, my certificates, everything's available online. You can look me up, you can get a good idea of what my skill set, my interests, my strengths are. But when you come to meet me in the office, I'm going to give you 100% of my attention. I'm going to give you 100% of my expertise. And on my end, that starts before the patient even gets into the office. I make a real point of looking up everything I can in their chart, combining all the data together that I know about them already. And then I think that allows a really focused discussion. It gives a real calming sense to patients when you walk into them and you say, "Hi, I'm Dr. Cunningham. I know a bit about you already. I've looked at everything that I can in your chart. I know quite a bit about your background. I know what's been done already in terms of surgeries or treatments, etc. I know what medications you're on. Here are my professional recommendations tailored to the particular pathology or particular issue that you're coming to see me for." Doesn't necessarily always mean that a surgery is going to be the right option. Obviously, you're coming to see a surgeon, so that's what we're going to focus on in terms of the options. And then really kind of giving patients a tailored approach of, these are the options, here are some of the technical considerations, but here's what they mean for you. Okay, here are what the potential impacts could be for you in terms of outcomes afterward. How much might this impact your life in terms of your work, your job, your family, your ability to travel or things like that. And then kind of coming up with a personalized treatment plan in conjunction with the patient. Just watching how much more radiant they are after a major surgery that they've put a lot of effort and work into up front, and now they're seeing the rewards on the far side or downstream of that. Kind of sharing that success with them, I think, is what really kind of gives me the warm and fuzzies on the inside. During my general surgery rotations, I got exposed to pretty much all fields and aspects of general surgery, and I really found with my bariatric rotation the opportunity to impact patients in a positive way before they suffer all the ill consequences of obesity was really what really appealed to me about it. And what I saw was patients who had been struggling with their weight and with obesity issues and all the related medical issues for decades, sometimes before they came to bariatric surgery, and seeing the life-altering impact, not just the numbers on a scale, but the reduction in medications, but even more so than that, the personal stories of patients being able to interact with their children, their grandchildren, being able to do more activities and get back to a much fuller and more but not just healthier, but more satisfactory and enjoyable life